हेलो गुड मॉर्निंग। मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के पास्ट ईयर क्वेश्चन पेपर। इन अ 60-year-old male, what is the primary etiology typically associated with Cushing disease? Small cell lung cancer, adrenal tumor, ectopic ECTS syndrome, pituitary microadenoma. Here the answer: pituitary microadenoma. Because the pituitary microadenoma is the most common cause of Cushing disease in a 60-year-old male. In a Cushing disease is a type of what hypercorticolism caused by an ACTS secreting pituitary adenoma, a benign tumor in the pituitary gland. This type of tumor overproduce ACTH, which stimulates the adrenal gland to produce excessive cortisol. If you look the small cell lung cancer, the certain cancer, most notably small cell lung cancer, can produce ACTH or ACTH like substance, resulting in Cushing syndrome. However, especially in the age group, this is not the most common cause of adrenal disease. That's why the answer is the pituitary microadenoma. Next question: a 30-year-old female patient presented with bone pain and abdominal cramps. Her family reported a previous history of abnormal behavior. The consultant doctor made a tentative diagnosis. Based on the clinical symptoms, what would be the most appropriate investigative method to establish a conclusive diagnosis? MRI, ultrasound, CT scan, and CT scan. uh, what is the answer here? The answer is the because the consultant doctor made a tentative diagnosis based on the clinical symptoms. What the clinical symptoms is the abnormal behavior, abdominal cramps, bone pain. Here the answer is the CT scan. Because the presence of bone pain, abdominal cramps, and a history of abnormal behavior point towards primary parathyroidism, most common cause in parathyroidinoma, and therefore the CT scan is the best answer according to the here questions. And what is the workup in primary hyperparathyroidism? Here the serum calcium increased, and serum phosphate is decreased, serum alkaline is elevated, and the serum PTH assay 2 to 3rd generation tremendous increases. Tremendous increases. Next question: a 50-year-old woman present with difficulty in activities like climbing stairs, getting up from a chair, and combing hair, Valaceous erythema of the upper eyelids was noted. What is the most probable diagnosis? Inclusion body, dermomyomatosis, polymyositis, scleroderma. Here the based on the symptoms is described likely diagnosis of dermatomyositis, because the dermatomyositis is at the inflammatory myopathy that causes muscle weakness. What causes the muscle weakness? As well as the skin involvement, and if it affects the both children and adults with a higher prevalence, and in middle aged people. If the dermatomyositis causes muscle weakness in the proximal muscles, and can also affect the muscle of the neck, and what affected the throat also, and making the swelling of difficulty in speaking. Here the answer. Next question: a young male patient present with ptosis and muscle weakness, which reportedly was in the evening and improves in the morning. This is relieved by Neet-Pg. What is the likely diagnosis? Myasthenia gravis, Huntington chorea, hematophytic sclerosis, external ophthalmoplegia. Here the what the question says: muscle weakness report worse in the evening and improves in the morning, and relieved by the word the Neet-Pg. The answer is the myasthenia gravis, because the myasthenia gravis is an autoimmune disorder characterized by the voluntary muscle weakness, which muscle voluntary muscle weakness, and fatigue caused by the antibodies that attack the neuromuscular junction. Ptosis is a common symptoms, as in muscle weakness, which tends to the worse with activity and improve with rest. Other symptoms include weakness, easy fatiguability, sustained upward gaze palsy, upward gaze and snarling faces, and difficulty in chewing and swallowing, tongue weakness, bulbar weakness, and here the news to mean increases amount of acetylcholine at the neuromuscular junction and can help elevate myasthenia gravis symptoms. Only have the myasthenia gravis symptoms. News to be. Next question, which palsy involves ipsilateral upper and lower half of the face, contralateral upper and lower half of the face, ipsilateral lower half of the face, contralateral lower half of the face. Which palsy involves the ipsilateral upper and lower halves of the face. What the involves ipsilateral same side and lower halves of the face. Bell's palsy is the most common form of the facial paralysis. Bell's palsy causes paralysis or weakness in both the upper and lower halves of the face on the same side. Ipsilateral same side, contralateral different side. Ipsilateral means same and contralateral is different side. The presence of incomplete paralysis in the first week is the most common favorable prognostic sign. Here the sensation of the taste sensation may be lost unilaterally and hyperacusis may be present. And next question, which of the following drug reduce mortality in a patient with heart failure? Metoprolol, furosemide, prazosin, tocilizumab. Here the answer is the metoprolol. Because the metoprolol, what is the metoprolol? Beta blocker. Beta blocker has shown in the lower mortality in heart failure patient. If ACE inhibitor have also been shown to decrease mortality in patient with heart failure. Most common drug used reduce mortality in patient with heart failure like ACE inhibitor, lisinopril, enalapril, ramipril, ARB such as losartan, jitne sartan group, losartan, valsartan, candesartan, and beta blocker, carvedilol, metoprolol, bisoprolol, and sacubitril, valsartan, Entresto, like combination drug that is an ARB or neprilysin inhibitor. What the inhibitor? Neprilysin inhibitor. The sacubitril and valsartan, Entresto is the same. Entresto, sacubitril, valsartan or Entresto. What is this combination drug that is in ARB or neprilysin inhibitor? So that's all, and keep revising. Thank you.